So I'm going to jump right in, Raj. Body and face surgeries seem like almost a side dish when it comes to conversations about beauty, especially while we are discussing celebrities. And keeping in mind our very conventional and conditional judgment around bodies, do you think plastic surgery is a boon, or do you think it's a bane for this generation that's all about self-love?
I think that's a very good question, Sonal, to start with. I think it's a boon and a bane. The boon is the fact that it does bring self-confidence, self-esteem, and for those who are in TV, media, and film, patients like mine, it does bring a lot of confidence back to them, and it boosts their performance in general. The bane is that one can get carried away, and there are instances where I turn down 2 or 3 out of 5 patients who may come to me asking for surgery, but I don't think they quite need them. So the bane really is that you're chasing an ideal which may not be achievable or not appropriate for you.
So when you say celebrities, those who come to you, are we naming names here? Or is it too early in the conversation?
We're too early in our conversation for me to do that.
Okay, I will take you up on that in a few minutes. So need versus wants. Where do plastic surgeries fall? Celebrities like Chrissy Teigen, Bella Hadid have openly admitted to having plastic surgery done. And this kind of openness wasn't the case until a few years ago. So when did suddenly plastic surgery fall into the essentials cart? Just like an avocado suddenly fell into an essentials cart.
So let me just clarify here. Plastic surgery is an umbrella term, and it incorporates reconstruction and cosmetic. Reconstruction is kids born with cleft lips, cancer reconstruction after mastectomy, or reconstruction after burns. So that's reconstruction. Cosmetic is, of course, the walking well who walk into my clinic and who want to enhance their looks and their beauty. So cosmetic per se, rather than, if I may correct you, it's not quite essential, it's desirable. So that is something that's very personal, which is why when cosmetic surgery is carried out by us, it's very important to do it in the context of the whole being, not just the physical characteristics, but the patient's persona, the personality, and their context within the environment.
So is there an overlap between this need versus want, cosmetic surgery versus plastic surgery? Do these worlds come together ever?
There is a huge overlap, yeah, because plastic surgery essentially is form and function. And of course, there's a huge overlap in between. In fact, I'd go as far as saying that if you are choosing a surgeon to have cosmetic surgery with, it's very important to look at their reconstructive background as well. Because if you're a reconstructor, you are that much more apt at dealing with body parts. You're that much apt at looking at the whole 3 or 4D parts of the body.
So where do then mommy makeovers fall? Is it a need to go for a mommy makeover, or is it a want?
So you probably picked that up from my website and from my Instagram, because I'm known for my mummy makeovers.
What is a mommy makeover to start with?
Yeah, so this is an interesting speciality which I have pioneered, which essentially is ladies in their 30s and 40s who've had 2 or 3 children, especially if they're breastfed, then the breasts lose their youthfulness and they fall southwards. The tummy becomes loose and lax, the muscles separate. So I do what's called a mummy makeover, where literally it's a 4 or 5 hour operation, 6 to 8 week recovery, and I literally restore youthfulness to their chest and their abdominal wall and their hip to waist ratio, all done in one operation. And this is a perfect hybrid of need and want, because of course the pregnancies do tend to disrupt your abdominal wall and the breasts after breastfeeding. So you're doing it partly aesthetic and partly function as well.
Okay, but before I ask you my next question, there is a reel that I wanted to play to show you, and I needed your opinion on it. Can we play that, please?
It started right from this to this by making changes to our face through plastic surgery procedure.
My face is untouched.
Yeah, this is untouched. Yes, that is a big lie.
Yeah, it's fine.
Nothing is natural. Let's decode what she has done. As we can see from this picture, the most prominent change is in her nose. Her transformation from a broader to a structured and slender nose is very remarkable. It is very evident that she must have undergone rhinoplasty surgery. And another noticeable aspect is her jawline. In earlier picture, it looked surgery is a personal choice and not a subject of shame. Stay tuned for more informative videos.
So my question for you is, Indian celebrities are still not very vocal about getting a job done. And firstly, how true are these reels? And secondly, do people realize that, this is an ongoing process? It's not a one-shot fix and they'll have to keep going to the surgeon again and again and again?
To answer your first question, I mean, it looks like a genuine reel, but what I can't tell you is whether the pictures are doctored or not. And this is where the problem is. And so for an average patient looking at that, great guy, great surgeon, great results. But I think it's very important to look beyond the Instagram pictures and to visit the surgeon, look at the credentials, look at the clinic, and to look at their experience in terms of their own photographs, undoctored. That's your answer to your first question. The second one is, sorry, what was your second question?
The second question is that do people realize that this is an ongoing process? It's not a one cure-it-all fix where you get one injection and then you are young forever. It's an ongoing process and it requires a lot of commitment to look good.
Yeah, I mean, non-surgical and surgical treatments are not forever. The non-surgical treatments can last up to 6 months to a year and have to be replenished. Surgical treatments last longer, but they're not lifelong. And it's very important that a patient who's getting into these treatments knows that. So you have to keep on maintaining yourself in order to make sure that you keep the results. So it's not a one-stop solution. The other thing is it's not just about treatments, it's about your whole well-being. So in terms of your eating healthy, sleeping well, hydration, skincare, and stress. I think stress is underrated. And it's very important to have all these factors in play if you're going to have a healthy lifestyle. And plastic surgery is only one component of it.
So it's interesting you say all of this because when we do interviews with a lot of celebrities, we get all of that. I sleep well, I drink water, I eat vegetables, all of that. But the main thing that is I get a Botox or I've got, rhinoplasty, that's always skipped out. So you've actually given us the whole prescription here of how to look like a zillion bucks. Okay. What about ethics? And how do they come into play for a surgeon, especially when you're operating on a celebrity? Do you kind of have to be a certain way, or are there some do's and don'ts, sign your NDAs, etc.?
So look, I treat every patient equally. When a celebrity walks in, when a princess walks in, for me, they're a patient. And it's very important as a surgeon, as a clinician, to look at them as a patient. Because otherwise what happens is your views and your assessment are biased and they're skewed, and they shouldn't be. Plastic surgery is serious stuff, be it non-surgical or surgical, and needs to be done seriously and carefully. So to answer your question, it's very important to assess them as individual patients. And if you feel that they don't deserve the surgery for whatever reason, either because then they don't need it, or because their expectations are too high and I can't meet them, or because they're medically unsafe to have surgery, then it's very important to be open and honest about this. And this is where problems happen, is where surgeons tend to transgress that line and go into territories where they're slightly rocky.
Have you had to turn down a patient because the expectations were very high? And what are the kind of expectations do people come with? Is it like an interior decorator's, shop where you go with your Pinterest mood board and say, this is what I want to look like? Like I want Kim Kardashian's face and I want Bella Hadid's cheeks and Deepika Padukone's lips. How does that work?
So that's a very good point. I mean, I turned down 2 or 3 out of 5 patients.
Sorry, how many?
2 to 3 out of 5 patients I turned down because I really want to make sure that they've done their homework and their expectations are realistic. Because if the expectations are here, and my ability to do is here, that gap is too wide. And that's when problems arise. So it's very important that the patient's expectations are realistic. So for example, I saw a patient the other day who's got a perfectly good hip-to-waist ratio, perfectly good figure, wanted to have buttocks like Kim Kardashian.
Is this a Bollywood celebrity? Because it sounds like one.
I think I'll carry on talking. So essentially, when it came to this, I assessed her, and I said to her, listen, your takeoff of the buttocks from the waist, and your apex point, and the curve down to the thighs, is very good and commensurate with the rest of your physique. You don't need it. And the other point I'll make here is that I don't like to operate and give results that I don't like myself. So I don't like that Kim Kardashian buttock. I don't like that shelf. So I will always be true to myself, true to the patient, and only do procedures where I feel that they deserve or need them.
Okay, can I request you to put your mic? Yeah, thank you. Okay, so I have a little bit of a personal question. Can you tell me about what have you got done? I'd like to know.
I'm blessed with great genes.
You drink water, let me guess.
I drink lots of water. And the odd adjustment, of course, doesn't go straight, does it?
So you're not going to name the celebrities. You're not going to tell us what you've gotten done. You're really having it easy. Okay, so the trend of getting quick fix surgeries started off in the West. We all know that. And we'd often hear of celebrities flying off to London, to LA for some kind of a job. And so the standards of beauty are very much still decided by the West. With so much beauty in every culture and facial nuances being so diverse in every culture, like a Zendaya cannot look like Angelina Jolie. Why is it that still a white woman or a white man is still my gold standard for beauty?
I haven't got all day to answer this question. This is a very good question. But I'm going to say to you one thing, which is, and it's a term that we all have heard of, beauty is in the eye of the beholder. And it's very important to know that. And secondly, that those ideals of the white woman and the white face and so on are all gone. Plastic surgery is international. Plastic surgery is out there. And of course, social media is the main vehicle by which plastic surgery is now exposed all around the world. So there's no kind of typical patient that you can aspire to now. There are lots of figures out there. I mean, of course, I can name a few Indian women who are aspirational in terms of their physique, in terms of their bone structure, in terms of their skin. So I think it's not just the West now. I think this is now universal.
So is there a certain culture or a country you would say that has the most botched up job? Like you always see like Russian women with a certain kind of a lip, or women in some countries with a certain kind of nose, and everyone's getting the same thing done and everyone's looking like each other if you see at the back. Tell us which country has great aesthetics when it comes to plastic surgeries and which ones are getting it all wrong.
I think social media has lots of benefits, but the one thing that it does do is making everyone look the same. The same lips, the same trout pout, the same cheeks. So to answer your question specifically, there is no country as such that has botched jobs or that has jobs that are a bit more wider and so on. I mean, I will say, I'm trained in the States, so I will say to you something. In the States, when plastic surgery is done, the patient wants to tell other people I've had plastic surgery done. So the surgeons almost lend themselves to that, and the breast implants are bigger, cheeks are fuller, the buttocks are wider. So it is cultural. In the States, I would say it's a bit more open, whereas we in London are very measured, very subtle in the results we deliver, because the average patient doesn't want to tell their neighbor or their friend that they've had plastic surgery done. They just want to feel good, look good in themselves, and gain that inner confidence.
What about Indian women? What are the kind of things that they want to do? How do they want to look? What are the kind of requests that they come to you with?
So again, that question is age specific. So the middle-aged women want to uplift the breasts and reduce the breasts and just regain the hip to waist ratio in terms of their hip diameter and so on. So it's more about body contouring and breast. The younger women are after the nose. The younger women are after the breasts in terms of enhancement.
Do you think Indian women don't have pretty noses?
No. I think. I mean, of course, there are lots of ethnic differences. There's a lot of differences in terms of geography. So, there's the northern nose or the southern nose. There are lots of differences, and it's very important as a surgeon to appreciate that, which is why the nose or the eyes or the breast is put in context with the rest of the patient.
Okay. So for a change, when it comes to plastic surgeries and the rise in sudden requests for plastic surgeries, the age is getting, younger by the day. For a change, we're not blaming pharma companies. We are not blaming big billboards that we blame for all the problems in the world. But actually the problem, or I would say the inspiration, comes from social media. The phone in my hand is suddenly making me want to look a certain way, is making everybody want to look like each other. What do you have to say about the role of social media when it comes to people's choices to look in a certain way?
Well, this is a great question, Sonal. I mean, social media now is the biggest platform and the biggest moderator of plastic surgery in the world. And of course, it's a friend and a foe. It is a friend because the potential patient can have a look on it and be able to get lots of information on the procedure, on the risks and benefits, and of course, they can get a whole write-up on the surgeon themselves. In fact, I'd go as far as saying that social media has upped our game as surgeons as well, because we know now that the results are out there straight away. There is no hiding the fact that as soon as you do the procedure, the patients are going to be out there taking selfies and putting them up on the internet. So it's actually a game changer, not just for the patients, but for us as well. And that's a good thing, because it means that we are accountable and we are appraised from the work we do. The bad thing about social media is what I mentioned earlier, is everyone's beginning to look the same, which is a bit of a shame because you lose your identity. But the other thing is that it does increase the expectations of the patient. Patients, have certain ideals that they aspire to, and they may not necessarily be able to get to that end goal. But they come to me, lots of patients come to me with pictures from the internet, from the social media, and say, Mr. Ragoowansi, I'd like to look like this. And of course, that's great. It's nice to have some kind of a benchmark, but it does raise their expectations somewhat, and it's upon the surgeon to make sure that if he or she is operating on them, that expectation is met. Because if it's not, that then produces the disgruntled patient.
So it's interesting you say that, because one thing I wonder is when somebody changes their face, when somebody gets surgery done, does it also affect their brain in some way?
Psychologically and mental well-being is a plus. When you're doing plastic surgery with the right person, at the right clinic, at the right time, for the right reason, then actually it can be a huge boost to your confidence and self-esteem. And I've seen that so many times. And that is the best thing you can have. You can have a woman who walks in as a consultation and is meek and humble and trying to wear a top to cover her chest, who 6 weeks later walks in confident, shoulders held up high, speaks well, and sits well, and that particular procedure has added confidence and value to their well-being.
So recently, in a Harper's Bazaar interview, it was our cover story where Kareena Kapoor said that she does not feel the need to get Botox done as she grows older. What are your thoughts on such a radical statement in this day and age? And according to a plastic surgeon, a celebrity plastic surgeon at that, what does perfection even mean?
Look, plastic surgery, cosmetic surgery, is the perfect marriage between art and science. And there are scientific parameters of what a face or a nose should look like or be within. And if I was to go into in detail, Fibonacci in the 13th century, as long ago as that, actually devised angles and proportions of the face and the body, and those still hold true for now. So the ideal face and ideal body characteristics are now scientifically proven. But on top of that, there's that added kind of artistry to plastic surgery, because you not only take into account the physical characteristics, you take into account the patient's, the way the patient is, the patient's behavior, the patient's context and what they do, and their social environment. So speaking of Kareena Kapoor, my wife's a Bollywood buff, so I know about Kareena Kapoor, and she is, I would say, in terms of, I've posed her a lot and I've viewed her from certain angles, and she's got the most perfect face as far as scientifically proportionate face is concerned. So for example, the distance between the hairline to the brow to the nose, and nose to the chin is in thirds, and it is with her. Oh, there she is, yeah. So it is in thirds. The other thing is the width of the eye and the width of the other eye equates to the distance between both inner eyes. So there is a fantastic proportion to her, and I would say she is the epitome of someone who is the ideal beauty.
So, there is this viral meme on the internet that says another day goes by and I still haven't practiced algebra and geometry. I can't say that today because you really made me go through a math class with Kareena's geometry. On that note, thank you very much, Raj. It was an absolute pleasure chatting with you.
Thank you very much. Thank you.